Hello, everybody. It's Kylie, Enoch's mom again. Um, Life has been life, and y'all. So I'm back though, and I'm excited to continue telling the story. I'm back here with my baby's picture, y'all. Isn't he handsome? Okay, so before I went forward, I wanted to go back to his earlier years, and before I do that, thank you. Thank you for listening. Thank you for watching. Thank you for sharing. Thank you for every heart, every thought, every prayer. Thank you. Now, let's go back. So, I was told at birth that Enoch had sickle cell disease. He was also born jaundice. So, he had to go under the phototherapy light. Um, if he wasn't under the phototherapy light, I had to sit in the window with him until so he could be in the sunlight until the jaundice resolved. So his skin was really yellow, his eyes were yellow. It did resolve though. Um, in his earlier years, he had hand and foot syndrome. That's when the hands and the feet swell. It's really painful. Most kids that suffer from that, they're able to be treated at home with heat pads and Tylenol and Motrin. Enoch always had to go in. He also had spleen sequestration. That's also a spleen crisis. The blood sickles in the spleen. The spleen gets really large. It stops the blood flow. They have to go in when they have that. It's an emergency. Enoch had that a few times. Have to be treated with pain meds, IV fluids, and blood transfusion. Most kids that suffer from this and reoccurring, they have to get their spleen taken out. Enoch never had to get his spleen taken out. I was always threatened with it though. He also had acute chest. I don't know how many times he's had acute chest. And I talked about that in one of my previous videos I did. That's pneumonia, but it's acute with children with sickle cell disease. He started the priapisms at age 4. And I talked about priapisms, which are painful erections, in a previous video also. So from newborn to age 5, Enoch had all of those things. He also had a mini stroke. Because of all of this, at the age of 5, bone marrow transplant was talked about, and we were pushing for it. We were tested as a family, but no one was a match. And we never visited again until later on in his life. In my next video, I'll start talking about what led up to his bone marrow transplant, why we went that route. Thank y'all for listening, and I'll see y'all then.